Hi.
Hi. I'm trying to figure out what's going on here. Something, I think because you logged in with your other account, we need to figure out how to get your other account working because this is...
I know, it's a pain in the neck. I've just come off another call where I was also a guest, even though it was in Cheshire, Mersey. I don't know what I've done, Alison, but is it a problem today?
No, it's not. I just had to change your settings.
Did you see that Paul Bagley has just put a suggestion up? I mean, we can...
Yeah.
If he's on the call, we can just ask him to say it. So have you...
not going to be. He sent me an email this morning saying he wasn't coming, but...
well, if you can grab what his comment is, that's...
Yeah, I'm doing that.
And have you done the tables as well, to where we start filling in what people suggest?
I didn't know you wanted a table, but I have a slide with a list that's ready to go.
As long as it's something that people say stuff, you can type it, and then we can have fun trying to put it in a 1 to 10 order, something like that kind. Yeah. Sorry, I'm sure you've done it.
No, it's all right. I have it in a side. I'll share my screen in a sec. I don't see Paul's thing. Where is it? He sent me an email. He was going to send it, but did he post it on the platform?
He must have done, because it's come through to me as an email from the network. Oh, it'll be under, the thing I posted as a comment or something. Do you want me to put it in the, I can put it in the WhatsApp. Do you want that?
In the WhatsApp?
Yeah.
What?
Or his comment.
Just to WhatsApp it to me?
Yeah, just done it.
Oh, yeah, sure, that's fine.
See, I can manage tech.
Beep, 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 yeah. I've listened to the Beatles all morning.
Well, nice.
Yeah.
I've been working.
Well, I've been working as well, but I can't.
I know.
I find it really difficult in the office, actually, because I can't work without music on. I can't sit there in silence and listen to the clacking away of people's computers.
You're such a millennial.
I don't know. I think I just have ADHD, and I just can't.
That's such a millennial thing as well. You've all got ADHD.
Yeah.
Jesus. I got to go to the loo. So.
Oh, okay.
Excuse me a minute.
Welcome back.
Somebody was trying to call me on Teams there. I could hear it dinging, but I didn't get to it. Carry somebody or other. So, we got 7 minutes. If you, me, and somebody else. Yeah, let's run through there. Hang on.
Oh, sorry. I thought you just wanted to see them.
Let me change. Okay, next one. Maybe put me last. Whatever I said. Somebody from Scotland got back to me and said, like, we're already doing two of these things.
True.
Quite right. Veronica. If Veronica's on, I'm going to ask her to talk to this.
Yeah.
Okay, Simon.
He's not going to be here.
Nah. Okay. Well,
neither is Paul.
Yeah, great. They've all got Christmas parties to go to.
Mm.
You know what? Tick off the word official.
Okay.
I'm sort of worried by, not worried, conscious of what was.
Board meeting yesterday.
Yeah.
Yeah. Do you like my snowflake that I made?
Oh, that was fantastic. You cut all those bits out yourself.
Mm-hmm.
So we could call it the fun hen wish list, just to make sure everybody understands this. No, don't put that in. No, that was a joke.
Okay, that's fine then.
Okay, I think we're good to go then. And if we've only got 3 people, then it'll be short.
Yeah. No, we've got 45 signed up, so.
Are you kidding?
I checked this morning.
Okay. Right. Well, we're good to go. And I'll just go on the thingy. I'm looking for.
But I found a driver, and that's a start.
Baby, you can drive my car.
Guy in the window across the street from me that I can see, and he's clearly on a work call, and I'm also clearly on a work call. And he's just standing, staring out the window, talking on the phone. Sometimes I can see all the way into his house when I sit at my desk. And it's kind of like a live TV.
The people behind us. Have I lost you? No, you just stopped talking. There's a whole story to tell you, but about cutting down trees and stuff. But now that we've got sight into each other's kitchens, more or less, and Simon said sometimes he sits with a coffee and looks out and says, "Okay, let the show begin," as we start going about our breakfast.
That's so funny.
And we both have binoculars that we look at birds in the garden, and both assure each other that we don't look into each other's house with our binoculars.
My dad got such a thing with our neighbor in the back because there was a tree that was on their property, but it was very much dead and very much going to fall on our house. Yeah. And he kept being like, dude, you got to cut it down because like I'll split it with you. I don't even care. It's just this is dangerous now. And he kept being like, no, like I don't want to cut down any trees, you know, the earth, man. And my dad was like, this is getting ridiculous. So he started chainsawing in the mornings the other dead trees. Yeah, on our property. So that you could be like, see, this is what's going to happen if you don't do this.
Well, after this webinar, we need to check in just to say how it went. And I'll tell you our story of cutting down trees with neighbors.
Yeah.
How's things? Did you get the cold home stuff done? You
Not
look
quite.
like you're in a cold home, actually.
Yeah, I am in a cold home. This is my friend's scarf. She lent it to me the other day because on the way to rehearsal, I forgot mine. But it's so soft and it's so warm. I never want to give it back. So I've been wearing it while I still have it. But no, I have to finish the text of the first 3 chapters for Angela by the end of today. And the only stuff that's left is my section that she didn't like. So I have to just rewrite it. But I really work best under pressure. Like I need the time deadline for it to get to me. Because yesterday, you know, we were in the office and I was kind of like, like just in the office, not really thinking. And I got in really early. I got in like 7:30. But by the time it gets dark in there, it's such a depressing office that it's just like, couldn't get anything done. So I started this morning and then I did some network stuff and then I'll get back onto it this afternoon.
Yeah. Oh well, good luck.
Yeah, pressure makes diamonds. That's what I always say.
What was that? Pressure what?
Pressure makes diamonds. That's what I always
Pressure
say.
makes diamonds. Okay. Yeah.
Yeah.
Cool.
I think people will start logging in now. It seems like people are
Yeah, they look like they
coming in.
are. Oh, I got 3, 4.
Yeah. I turned off the meeting room because it always, or the waiting room, because it always dings and it's really annoying. So I can't tell. Yeah, we should be good. Hi everyone.
Hi. Hi, Sam. You're the only one I can see at the minute.
Mm.
Hello.
Oh, we were emailing recently, weren't we, Sam?
We were, yes.
Yeah. Just coming back.
Good to put a face to a name.
Yeah, yours too. Hi, Gail.
Hi,
How are you?
I'm okay. Yeah, not too bad. Nice to see you in person. I see
Yeah.
lots of your messages. I never see the person behind it.
Sorry to disappoint. Hi,
No,
Abigail.
it's good. It's always nice to meet people, put a face to the name.
Yeah. So we'll just allow a bit of time for other people to join. You are on the webinar, our wishlist webinar. And
Congratulations on your job, Abigail.
Yeah, it's going well, thanks. Yeah, I'm week 4, so it's still, you know, that bit where you're kind of like just reading a lot and your head's full and meeting lots of new people and figuring it out. But all good so far, thank you. Yeah, nice to see you guys.
Yeah, you too. I used to give myself about 6 months to get into a job. You know, first 6 months while you're working out what to do and who's who. So
Yeah, that's a nice way to think of it. I'll be kind to myself in that way. Yeah.
Hi, Felicity.
Hi, Alan.
And just to say, everybody else, if you can come on screen, then that's a good thing. If you can't, then that's fine as well. We're only a minute in. I think we got somewhere like 45 people have registered for the webinar, and of course, hi Anne. We only get half that number turning up, and if this time of the year is particularly pressured, but we'll allow a bit more time.
I'm doing quite well so far. Sometimes we get 5 minutes in and we've only got 25 people, so
yeah, not bad.
Seem to talk about the incoming government.
Yeah. So when we get going, we'll be starting off with a review of what a few people have put up as their wish list. And then we'll be taking suggestions from people on the call and trying to make a top 10 of Health Equity Network wish list for 2024 on social determinants. And I'm kind of resisting the temptation, although I'm going to call it this now, but I'm resisting the temptation to call this a fun Christmas thing to do, because somehow at this time of year you get drawn into that, whereas we're talking very serious stuff here. So, yeah. Hi, Jen.
It's still more fun than the mornings meetings I've had, which were all about planning and finance. So this is light relief.
Light relief.
Says a lot about my week, doesn't it? Yeah.
Yeah. Right. We're okay. 3 minutes in. We've got 22 people. Hi, Elizabeth.
It feels like a break sometimes when you're just using a different bit of your brain, though, doesn't it, Gail? Just sort of, you know, just thinking slightly differently helps. Yeah, helps a lot.
So just so everyone is aware, we do record these webinars to have posted onto the platform. So if anyone doesn't want their face in the recording, you can just take your camera off. But I am going to start recording now.
Good. Hi, Orla. Thanks for sending that stuff through about the work in Salford. Looks great. Good to see that. So we'll make a start. My name's Alan Higgins. I'm Health Equity Network Lead. And Alison?
Yes, hi, I'm Alison, and I'm the Health Equity Network Coordinator.
And you've been getting various emails from us over the last few months. And this is the monthly webinar. And the theme for today is to construct a wish list of what we would want to see in 2024. Thanks, Grace. As things that you would want the incoming government to consider for social determinants of health. I'm making the assumption that there will be the election in 2024, and I know that it could really run to 2025, but let's assume it's going to happen next year. If you have been on the webinar before, you'll know that we try to keep this informal. If you haven't been, then welcome. There isn't going to be a series of speakers this time. It'll just be me running through what people have submitted, and then we're going to encourage you to come up with more suggestions, and we'll try to run some kind of voting on which should be number 1 through to 10. And if we don't get that particularly coherent, at least we'll have had some thought and fun about how we put that list together. So by all means, do come on screen. But again, if you're not in the position to do so, that's absolutely fine. And when you get the turn, please be vociferous for your particular causes that you want to see at the top of the list. So we'll start with something that I'm just going to challenge you, Alison, while I talk through the first slide, is that Grace has put something in the chat, and if you want to copy those into a slide, then have a go. But Alison,
I'll be quick. Yeah.
Yeah. Do you want to go with the first slide while you're doing that?
Yes. Give me 1 second to put Grace's comments in here, and then I will share my screen.
And be aware that if you have put up some comments, then when it comes to them on the slide, I will invite you to talk to them. Grace.
Okay, here we go.
So I'll talk through some of these. Yep, got it. So I was looking around for what has been posted over the last few months. And I found this one from the BMA, was looking at, I think this was particularly social determinants of health. So acknowledge that good population health and well-being, together with climate change, environmental degradation, are crucial to a sustainable future. Okay, so getting the government to acknowledge that would be something. Recognise that well-functioning health systems are important, but the principal determinants of health and well-being lie outside healthcare. You know, we're all, I think, signed up to the Marmot social determinants program. So again, getting that recognised at government level and embedded would be a great thing. Promote greater equality in health and address inequalities. Prioritise population health and well-being across the life course in policy decisions. And then, interesting one here, incorporating metrics of population health and well-being into measures of national progress and performance. What I'm reading into that is that they're looking for population health and well-being to be built into economic policy, for instance, and then the policies that are about national progress and performance. So there's, I would suggest, not much to disagree with there, but you might have different priorities in it. I think somebody's possibly got their mic on, and there's a little bit of background noise that is stopped. No. Thank you for that. So next slide. So I then also thought, well, what do I think? And I went back a few months to where I did this a while ago, and there was much that you could pick up on, but I was thinking, well, housing policy to promote affordable insulated homes, particular emphasis on the rental sector. It's becoming very apparent just what a housing crisis that we have got, and how important housing is for health, I think, is possibly something that we'll all recognise. That's what I went for my first priority: housing policy, affordable insulated homes. Rental sectors where there's particular problems. And then looking at the rate of universal credit, as well as removing the restrictions related to total benefits and multiple children. And universal credit, a whole benefit system, and a whole social protection system is so key to underpinning people's health that I thought I'll go for that one. Third point for me, prioritizing health and well-being in economic planning. That's one that has been a theme of mine for some time when I was working in Liverpool City region about getting well-being into economic planning. Change to transport policy to reduce car use. And then again, another one that I worked on in my past at some point, minimum unit price on alcohol would be one that I would want to see prioritized. Somebody who, I don't know if I think it was Lisa, I don't know if Lisa's on the call, did then respond to say, look, we've got at least two of these things, one in place in Scotland and one in train in Scotland. The one that's in place is minimum unit price on alcohol. And so far as I'm understanding the evaluation, it seems to be having an impact. And the other one that they're progressing in Scotland, looking to forward to bring it into government policy next year, is about community wellbeing in economic planning. So great, let's see how that goes. Next one, Alison. Veronica, I haven't checked Veronica. Are you on the call? I can go through the people thing here. And Veronica's not on the call, so I will run through those myself. But Veronica, one of our network members, which is a GP as well as many other things, put out reducing child poverty by 50% in the next 50 years. And I think Veronica was particularly keen to see that we have things that are measurable. So that target of 50% reduction is particularly relevant here. Develop rural health indicators to better capture rural health data and allow better policy development for rural communities. Veronica is our champion around rural health. She ran a workshop on it at the conference in October in Birmingham. And interesting to see about having some better data about rural health indicators would be useful. Develop a national plan for addressing the social determinants of health. And Veronica posted a link to the US national plan. And I have to say, I haven't actually looked through that yet, but that was new to me. I wasn't aware that that was being done. I think it was just in November. And that's interesting because one of the times at which in the UK we have managed to close the gap in life expectancy, between the best off and the worst off, was when we had a national health inequalities strategy back in early 2000s, I think that was, late 90s, early 2000s. And there's evidence there that that plan led to a closing of that gap. So interesting in Veronica's suggestion about having a national plan. And then fourth point, commit to action on already identified health inequalities. So that kind of taps into the thought that, you know, we know where the problems are. We also know by and large what we need to do. So actually committing to action on it would be a good thing in 2024. Next one. Thanks, Alison. Simon, another network member, again, wasn't able to join the call today, I think, unless Simon jumps in now. No. Reduce relative and absolute poverty, improve equity of wealth distribution. That's a very key political consideration about, as well as looking at having a tax system that redistributes wealth through income tax. You could also be looking at a wealth distribution. Support transition to green economy, sustainable development, yep. Improve UK communities and housing stock, yep. Improve food system from farm to fork. Interesting to see the food system acknowledged there as a possible priority. Such an enormous system with impacts across so many of the things that relate to employment, but also about the way that you can have an impact on the environment. Invest in early years provision to improve school readiness. Great one there. Of course, that's been a Marmot theme number one for 20 odd years or so. Relentless focus through the ICS on outcome quality improvement, including health determinants. I'd love Simon to be here to unpack that one a bit more. I think I know what he's getting at about looking at quality improvement through healthcare services. And I can completely understand why that's a health inequalities issue, because not everybody gets the same access to services, but even when you get access, you don't get the same outcomes of the service as well. So great to have that one there too. Next one, Alison. Grace. So Grace, I know you're on the call. Please talk through your
Yes, yeah, of course. I'm sorry, I did just throw them together at the beginning, but very happy to talk to them. So yeah, so with the first one, it's fantastic that levelling up hasn't gone anywhere, and I think there was fears that it had, and there's still lots of conversations around evolution going on. But we were promised a health inequalities white paper to help unpick the priority actions. I think it was priority 7 and 8 off the top of my head. So it'd be really great to have some national government strategic direction to help inform how we go around closing the gap in healthy life expectancy between our most and least deprived areas, both intra-regionally and inter-regionally, and then as well as any dedicated funding streams that come from that, and just that commitment for that to be implemented as well. Again, with the cross-government mental health strategy, that was something that was promised, or there had been talks that was going to be developed. I think this was the middle of last year, and it just almost evaporated into thin air. And again, that's one of our biggest growing population health issues. It's now become a crisis, especially within our children and young people. The knock-on effect that that's going to have for our future productivity, the health of the nation. So again, that commitment to A, be taking that seriously, and B, for that to be a holistic approach, thinking about, taking measured steps to actually prevent poor mental health and further mental health crises. Health and all policies approach across all government departments, and very much building on Marmot approach. We know that that holistic policy approach works. Look at places like Coventry, for example, Greater Manchester, having a more unified holistic approach across the government will definitely be a key ask. Inclusive growth principles embedded into green book processes. So similar, Alan, to what you were saying in terms of embedding well-being outcomes into economic development within Liverpool, seeing that as more of a top-down approach from government green book processes, longer term funding models, so particularly thinking about our fantastic but yet our crumbling voluntary and community sector, which is so important when we're thinking about improving health and well-being, reducing health inequalities, community empowerment, transferring wealth, etc. Short-term funding models we know are breaking that sector. Of course, the case for greater, deeper Devo, both to regional and local authorities, being able to understand the needs of their local populations and allocate resources, decision making, etc. And then I think a key issue that we have is around the centralisation of fragmented data, and how much more we could do with sharing data, and how advanced, it is absolutely possible to do it. We can think about all the clever stuff that the private sector does with their data, and that we, are unfortunately really lagging behind in our data prowess, and how much we could be identifying need and preventing poor health, and encouraging holistic join up of services, wraparound support. I think that's
excellent.
Yeah.
Thanks very much, Grace. That's been really useful. Is there another slide, Alison, with other priorities on, or not? Oh, Paul. Of course, Paul posted this just before we came on the webinar. And this, despite well-proven health benefits, parks and open space, non-statutory service, increase in pressure to build on urban open space, no statutory consultee appointed to comment on loss of open green space. So the government, she set a statutory minimum area of provision, particularly important in low-income areas, or at the very least, appoint a statutory consultee to comment on plans and proposals to build an urban green space. So priority there about maintaining the green space in urban environments. Great one, thanks, Paul. Is that the last one, Alison? I think that was.
Yes.
Right. So Might need to flick back to those in a minute, but we'll move on from there. So thanks everyone who posted their thoughts. So the first question, is there anything missing from what people have got up that is a particular issue for you, or something that you particularly want to highlight? And then we'll move on into the top 10. Sam.
Hi, yeah, I think everything that has already been put forward is great. You know, I don't disagree with anything like that. I think just honing down on what we're talking about, the housing crisis, and specifically around temporary accommodation. There's 139,000 kids that live in temporary accommodation. Lots of them are in really poor housing, and you know, we're all experts in this kind of health inequalities world. I don't need to go into the details of that in terms of the health impacts, but lots of all the things that we're talking about in terms of access to green space, you know, nutritional access, mental health support, all that all feeds into almost like the tipping point of the housing crisis, which is kids in TA. And there's loads of evidence linking rough sleeping to child homelessness and ACEs and childhood trauma. So if we're thinking of like your 20-year strategy on reducing rough sleeping, you got to start with perinatal support, with pregnant mums that are homeless, because there's a massive link between all that, as you know. So I would hone down just a bit more on what we talk about housing into more temporary accommodation, whilst linking in everything that you've already said.
Yeah. Well, no, great to have that suggestion. So housing particularly as the focal point there. Excellent. Gail.
Hi. In my role, I'm the lead for our ICB for children's mental health, but also all age mental health inequalities. Hence my comment in the chat. I think with any of this, I totally agree about the mental health strategy, which we all did a lot of work on. It got binned and became a paragraph in a long-term conditions one. It's about the funding and the parity of esteem for funding. So I use mental health as an example. I'm sure we could have picked any of those topics. So only 7% of all mental health funding nationally goes on children. And yet, I'm not saying adults shouldn't have good provision, but if we fix it in children, we fix the longer term. The other thing is about long-term and sustainable funding around health inequalities. What I have to deal with quite often, I've just had one today, I'm sure there'll be a ministerial announcement. Sorry, I'm being slightly cynical. So I see on the news, £6 million more for children's mental health. What they never say is, it's non-recurrent, we're giving you it in January, it's got to be spent by March. So I think there's something about, to take the phrase of a certain party, a fully costed strategy, a fully funded strategy for any of these things, although obviously I'm particular around mental health. I guess the other bit for me is I would like to see, and this could be in a health inequality strategy, which I certainly think we need, a stronger emphasis on the public sector equalities duty. So I'm one of those annoying people who bangs on about it, and I'm actually holding services to account. So we're doing a annual health inequalities audit of who accesses mental health services for children. That could lead to a full health inequality impact assessment, but I'm trying not to scare people. I'm just trying to get the data at first. And then that allows us to know who we're not reaching. So it could be, like you said, Sam, rough sleepers. It could be, but until we get measured on activity and numbers accessing. The children's target is the number of children who've accessed one session of mental health support, which quite frankly is meaningless. So if a service says they'll see 500 people and they see 500 people, everybody goes, yay. I'm like, but are they the people who really need it? Are there certain communities we're not reaching? And I kind of feel like the public sector equalities duty has become a tick box. So I'd really like to see that strongly in any, because it's a fabulous tool. And I've used it lots as a commissioner in the past and currently. And it helps us understand, particularly at an ICB level, the different communities. So one place might be reaching their communities, one might not. It might identify, we even did it by first 3 letters of postcode. So we picked up certain rural areas that were really disadvantaged, who wouldn't have shown up on the core 25 around water deprivation. And I guess my last bit is the intersectionality. So we have an advisory group of over 200 young people in our ICB. I can't take the credit. I've got a fabulous co-production lead. And we know LGBT young people are more likely to have poor mental health. We know certain ethnic groups are. But what young people said to us is, okay, so I'm a black, gay care leaver who's living in a hostel. That actually puts my mental health risk at 80%. Where when you do it just by being a care leaver or just by being this, it almost diminishes. So it's something about, it is important we think of those different inclusion groups, but that we don't lose the intersectionality in that. Does that make sense?
Yeah. Those are
Sorry,
excellent
stop
points.
ranting now.
Sorry, I just, Alison, are you making note of these for the table? You are. Thanks very much.
Oh, good. Yes.
Now we'll come back to them, and the ones that Sam made as well. Really interesting points, Gail, and the public sector equality duty one is one that maybe we can follow up a bit later in the discussion, because it kind of, for me, also relates to the idea of moving perhaps from pushing for health in all policies, but moving towards equity in all policies and provision and implementation as well. But let's pick that up again in a moment. Jen, go ahead.
Hi, yeah, so I agree with what you were saying, Alan, and Sam as well around the housing. And I just pick up a couple of other things. So I think there was a commitment to review the fuel poverty strategy. So I think that needs looked at, obviously, with the cost of living crisis and the change to the minimum energy efficiency standards that's not coming in. The other thing, again, agree with the long-term funding. I think particularly things around long-term funding for retrofit. So those of us that are involved in kind of heating and insulation, the eco grants that come every sort of couple of years is very difficult in terms of addressing those inequalities, creating the infrastructure locally, and our kind of businesses training up and actually believing in a sort of long-term scheme they can invest in as well. So I think it's really about having a plan to improve health and housing as a priority, linking to the life course approach, and also things like damp and mould. I don't know if there's a sort of statutory duty that's been linked in there. And then the other one is the new adverse weather and health plan that came out. And there's a sort of evidence document in there, and it points to lots of holes in the evidence in terms of those risk groups that are at risk of cold weather. So more work on that as well. But yeah, I agree with the kind of devolution and data sharing. That'd be great if we could actually target some of the people that we know are at risk. Thank you.
Thanks, Jen. It's adverse weather and health plan. So I've missed that. Is that fairly recent?
I'll send you the link. Yeah, so there used to be a cold weather plan and a warm weather plan, and basically they've combined the two, and it sets out the kind of requirements for local, national government, and things like different partners that are involved, so commissioning services, and it's linked to the adverse weather alerts that come out. So it's UK HSA, I think, that have pulled it together, but I'll put the link in the chat.
Excellent. Thank you very much. And again, after we've heard views, I might just come back to the idea of what do we actually do as public health or people with a health interest to influence housing developments. What are the tactics for us working on that? Abigail.
Hi there. Yes, just wanted to put in a few ideas, but a strong seconding for the public sector equality duty and thinking about how we can kind of give that kind of meaningful teeth as well in terms of the duties required of it. And I guess something that I'm quite interested in as well, working in a borough where I think it's 40% of children are in social housing, 40% go to private school at secondary school age. There's thinking about, to retain a charitable status, what is it that we would require of private schools, but also thinking about it in terms of an inclusive society, because it's not just about sort of patronage to others, it's about realizing some of the gaps in inclusive understanding that you might have if you're part of a private school education as opposed to a sort of state school education. So thinking about some of those requirements for their status. Again, completely agree with greater parity for children's health funding, but recognising that we would need to fund different things. It's not just about healthcare. If we were to increase that proportion for children, young people, but in particular thinking about some of those whole family approaches, because we target and identify adults, grandparents really well, who may have a number of sort of social and health risk factors. Are we following up to think about the whole family who are also having those risk factors, not just waiting until something's happened for them from that social side of things as well? Thirdly, I mean, we've got to sort out early years childcare funding, make sure that we're investing in it so it's high quality. We're not kind of reducing that quality in order to achieve greater coverage. It really needs prioritising. And then lastly, thinking about care experience and the potential, the conversations around that being a protected characteristic. But then also, what's the guarantee that goes alongside that for care experienced young people, particularly those leaving the care sector, and guarantees for employment, and not just entry level employment, thinking about continued support and pipelines and that sort of thing as well. By 2 pennies.
Excellent. Thanks very much, Abigail. Very specific points there. Oh, I've lost. Oh, here I am. Go ahead, Anne.
Hi, thanks. Yeah, just following up on the housing thing, I really agree with your point, Alan, on the rental sector. But could we make it more focused on private rental sector? Because one of my focuses in the work that I do in public health is on housing. And what we tend to find is that social landlords, they all have their own sort of ethics and policies and procedures around that. But the private rental sector is really hard to even understand what the issues are. We can sort of have a good guess at what the issues are. But and the only real sort of tool that we have in our armory at the minute to deal with that is selective licensing, which is really expensive, really labour intensive, and is a huge rigmarole to get involved in. And has been a very focused area of housing. So it's something other than that to sort of support bringing up the quality of private rented accommodation would work really well in my head. Also on housing, we've started to look at using design codes, which we haven't really got the depth behind design codes yet, coming out of the Levelling Up Act, but our intention is to use design codes, which I believe are sort of compulsory once you adopt them, to underpin our local plan with health elements, so that we have design codes sort of wrapped around health. So sort of enabling that and sort of encouraging people to do that feels like a good idea to me, although we haven't yet got any experience of doing it. And the only other thing I was going to say was about the economic. Having come from an economic regeneration background, the last business case that I wrote had a sixth business case, which was around inclusive growth and well-being and all of the things that somebody suggested. Was it Grace suggested that? So it's definitely doable, and there are models out there that adopt that. So if we could extend that to everybody and all of the Green Book business cases that everybody writes, I would completely agree with that. It's a good starting point. That's all I've got. Thanks.
Excellent. And I'll ask Alison to put the slide up in a minute of what we've recorded, but I was just noting as well, particularly as you were speaking, Abigail, that these are political issues, and we deal with them through our work angle, but the early years childcare funding is a political issue that's been discussed over the last few months, with various proposals coming forward. And it's kind of always interesting to get that sense of when we are doing work from a professional perspective and when it kind of tips into the political arena as well, and how people negotiate that in their day-to-day working. But if anyone wants to pick up on that, I'd be more than happy to talk further. And there is another hand up. Noor, please go ahead.
Hi, Alan. Hi. Can you hear me? Sorry.
Yes. Yep.
Hi. Thank you, Alan. I think partly it's already been covered. I just want to highlight one point on including the inclusion health groups. For example, the homeless, struggle cohort, vulnerable, migrants, gypsy, Roma travelers, and the sex worker and people who are in contact with the justice system and victims. I think that'd be good to have separate policy regarding those one, because if you see the NHS core 20+5 policy, the plus group is already mentioned on those. So I think wonder if we can highlight those one as well as separate policy on. I can see there was Southeast Health Inclusion Network last week as well. They already start, I think, how we can engage these different networks within different regions to work on those. So I just thought that just briefly mention that one.
Yeah. Great. Thanks very much, Nur.
Thank you.
Okay. Shall we go with what you've got so far, Alison? And I'm expecting that we'll have housing up at our front.
I just want to quickly bring in John. John is a member of our advisory board, and I wanted to make sure that you had a moment to speak if you wanted to. If you wanted to jump in now.
Oh, thanks, Alison. Yeah, I mean, I think most people have covered the things. We're just launching our manifesto today, which we've co-produced with communities across Great Britain. So that's kind of representing thousands of people. It was quite hard to get down to 5 or 6 points that people really wanted, but most people have already covered them, so I won't repeat them. And I'm sorry I missed the start of the session, so I'm sorry if this has already been covered, but one of them that came out really strongly was supporting improved health through good quality work and training, and in specifically around the issue to do with young people and apprenticeships, which is failing pretty catastrophically for a lot of young people, particularly who experience disadvantage. So that's really, and the Resolution Foundation is just a really great piece of work on this. But also one of the clear things that came in was also the pathways to good quality work, as in the having the right kinds of agencies on the ground who really understand and know people, and are much more able to support people into work, particularly where language is the first barrier that people experience. So those things came across, they were really high on people's agenda. And the only other thing that I don't think has been mentioned, but has probably partly, is investing in community assets which actually combat social isolation, social isolation being a protective factor in terms of health and health inequalities, but also the secondary part, which is improving the rights for greater local power through things like the We're Right Here campaign, which is a call for a Community Power Act to embed those rights within communities, which goes much further than the current legislation that we've got. And we also, like everybody else that's spoken, also really calling for cross-government responsibility for addressing health inequalities. So not just looking at the introduction of a health inequality strategy, and looking, at all of the issues around that, but also looking to even go further than that, to consider whether there could be a health inequalities commission or a commissioner of some kind who's really driving this within government, because that is completely absent. And until there is that kind of accountability sitting, reporting into and influencing Number 10 in the Cabinet Office, then I think we're on a hiding to nothing with a lot of this, particularly as any incoming government's got one hell of a job with the fiscal situation. So those were the only additional things, and I'm sorry some of those were mentioned before I came in.
No, I think those were new and welcome additions. Thanks very much, John. Orla, do you want to come back on anything new or on John's points, actually?
Yeah, please. It was just John had made me think of something, and Alan, I think it was on your list as well, around sort of embedding health and wellbeing into economic development, which obviously, based on the work that I'm doing, it's a personal and professional interest. But when we were looking at some of the links in health and work and training, and when young people are leaving school, their options are sort of limited to go on to further and higher education or get a job, and a lot of the time locally those job opportunities are very limited, and some of the apprenticeships, like John had mentioned, aren't working for people, are not available, all these lists of things. So whenever it comes to things like owning your own business, entrepreneurship, those things really aren't prioritized quite often, or there isn't any sort of clear pathways for people to go into those. But then additionally on that also social business, and we know that there's huge links to health and wellbeing in social business. Glasgow Caledonian University, the UNIS Centre there, they've been doing research for over 10 years on the links between social business and health. So it would be good to see sort of a national priority on creating those pathways for people, young people, but really any age to get into, you know, they're having better economic options, especially social business, where they themselves and the businesses can experience better health and wellbeing, but also that wider impact on the community and the sort of social value that's created on top of that as well. So yeah, I think that's something I'd like to see as well.
Excellent. And if anyone else is interested, then maybe, or you could post a link to the UNIS Institute. It's if you have it, because they have been doing great work in Glasgow for some time.
Yeah, I'll link it in the chat.
Yeah, I think John just asked for it as well. So,
yeah, no worries. I'll do that.
YUNIS is the UNIS is the spelling, I think.
YUNUS, yeah. I think we have links to Cam and Michael just for work we're doing. We got in touch with them. I think I told them about the Health Equity Network, so I think they might be members now, but I'm not I can't remember if they definitely signed up or that, but I'll
Excellent. Keep the pressure on, Orla, because we tried to get Cameron to speak at our conference in Birmingham, but it just didn't work out. But we'd love to hear from him and the research that they've been doing about social business. Alison, shall we go back to the list that we have? So housing, and I guess this is partly in the way that it came out through the discussion time-wise, but it felt to me that housing was such a recurrent theme in what we were in what people were saying, that would be a fixture on our wish list. Sam went into some of the more details around what particular aspects of housing would be important, but I think he was saying housing as the bedrock for reducing inequalities in health. John, you posted an interesting comment that said, let's not just focus on private sector, because I think I perhaps drift that way, that we also need to make sure that the social housing sector is functioning. And I used to work in Greater Manchester, where a DPH, I think, used to refer to tongue-in-cheek as the social housing sector as being the intensive care ward for health inequalities work. And, you know, that's where we should be focusing a lot of our attention. So housing, yep, definitely in there. Children came up several times. One, and the children's mental health services and funding for services there. But then also, further down there, we've got children, young people, whole family approaches, childcare funding. And if I can also mention here, Abigail's point about early years childcare funding as well. And I wonder, I think it's possibly too much, Alison, to ask you to do it now, but wrong term, bringing those different points together into a single point around children's well-being might be a way of emphasizing that point. Where else have we got? Education, private versus state school. Wow. Is there a potentially hotter political issue than this? And I was recalling that someone once said that when Clement Attlee was working post-war in the Labour government post-war, that tackling the health service provision, he was building on other people's work as well, but was a major step forward for reducing inequalities in health. And where he stopped was in perhaps reforming the education sector. And that had they been more, if they'd been a bit more on top of reforming the private sector education, perhaps that would have had a longer term effect on inequalities in health in decades to come. Anyway, I digress a bit, but interesting to raise that point about the charitable status of private sector, but also thanks, Abigail, for developing that into a point about what that means for inclusivity as a broader concept as well. Private sector rental comes up again. Good quality work and training for young people. That's an interesting point, which I would suggest perhaps we would put higher up than the one that I put up initially, which was about community well-being or not community well-being, community wealth building in economic policy. Partly because it's more tangible. It feels that that's something that the work around the priority around good quality work and training for young people, apprenticeships, is something we should be doing already. You know, it has been in there for some time, but it should be in a better state. And whilst I would, you know, I advocate for population well-being being a feature within economic planning, it's still something as a bit of a niche area. But let's see how they're going to go on with this in Scotland as well. Let me open it up again, either to respond to some of the things I've just said, but also with the wish list that you've got in front of you. Comment on that. Which things would you want to put further up that wish list? Anyone want to go? Does it capture what you wanted to see in the first instance? Go ahead, Gail.
I appreciate the person taking the notes. This isn't a criticism because you're probably typing manically. I think it's more than just a public sector equality duty because we have that. I think it's about it being strengthened and organisations being held to account for it, because it kind of feels like it's there in legislation. Everyone's supposed to do it. I think they're only supposed to do it once every sort of 5 years or something. Sorry, something just popped up and I hate it when that happens in the corner of my screen. So I think it's that strengthening and accountability and not just being a tick box exercise once every 5 years. And actually doing something about the findings. Because I know loads of people go, oh yeah, we did it, and we know who accesses our services and who doesn't. And I'm like, so what? What are you doing about it?
And you're right to bring it up again, Gail, because that was a strong point early on in the discussion, and I didn't cover it in my summary as I did.
No,
just
it's fine. It's fine, and I appreciate the person typing is probably trying to capture a lot of that. So yeah, thank you.
Well, thanks for emphasising that again. Thank you, John.
Yeah, thanks for capturing all those. That's not easy to do that as you go along. It's like being a stenographer. I was just thinking that I wonder if what would be really good to do with if you were prioritising these is to bring up the social determinants up and social and economic determinants up the list, because some of these are, you know, and fully accept things like, you know, a long-term funding for children's mental health is really critical. However, some of those things are exacerbated in the start by the social and economic determinants. So actually, I would kind of think pushing, you know, housing absolutely right up there, but work also sits up there alongside income, which is different to work and can be the same, but is not for a lot of people. So, you know, good work versus the income that you've got and the safety net issues, and then you know, the kind of training elements in that. So that what you cover off is all the people having the requisite resources to be able to live properly in the first place, including, so what I think you move into much more is the things at the top of the list for me, which are human rights, actually, you know, and sit in the Human Rights Declaration. So actually, you know, the right to warm space, to food, to all of those things are captured by a couple of really key elements and points which you can list underneath. So I would push the sort of social and economic determinants up to the top, which is not to say that the other things aren't important, but I think they would nest under them more naturally, under those kind of big headings. If that makes sense, Alan, I'm not sure if it does.
Oh, it does. I completely appreciate that point, and would support it. And it's, I mean, we are putting this list together for our own benefits on this occasion. We're not necessarily going to go far with it, but I would like to be able to publish something on the network after the webinar. So we will tidy this up a bit. But yes, I absolutely agree with that point, John, about making sure we've got social determinants at the top of the list. Gail, is that an old hand, or do you want to come back in again? It's an old hand. Okay, Ben.
Thank you. This is my first time at one of these meetings. It's just find it really interesting. I'm not sure whether you can hear me okay.
Yes.
Or whether you can see me. Can you see me? I think my computer just seems to have had a bit of a meltdown and is flashing and all kinds of things. Brilliant. Because at the moment I can't see very much. But yeah, I think this is really interesting. And so it's the first meeting I've been to here. But I was wondering whether the point about the commission would be worth moving up, because I think it's really important that there, as other people have said, there's accountability. And I just wonder whether having a commission or a commissioner in place would ensure there's greater coordination, would ensure that there is funding available, and it means that another government couldn't come in and say, oh, well, if it's just guidance, then we won't listen to that. Or, making sure whether there's something in legislation. I know there might be problems around putting something in legislation, but making sure it is something which is very clear, which there are that another government can't come in and change priorities because there's a commission there or a commissioner there saying this is what we need to focus on.
Excellent. I'm just trying to think, what would that look like, and how would we have to get to how would that have to be framed to get support? I think it's an excellent idea.
And I'm not sure. Sorry, I was just like thinking, I'm wondering whether it could be. I don't know. Again, I don't know whether making it non-political would take it out of the government too much, but something which is either within the cabinet or or is cross-party or is outside government, but still is something which needs to be listened to. I say, rather than a government coming in and just saying, well, it's guidance, or it's just a group of people who are saying this is a good idea and they don't have to listen to it, but something which includes across the political spectrum or outside that, which the government need to listen to. But I don't know how it would be organised. I think it is a problem.
I mean, one of the thoughts I have occasionally, I'll come back to you in just a second, Gil, is the feeling that so much of this looks obvious to me. Why isn't this happening? And that so many of the other problems that governments have to deal with around pressure on the NHS could be resolved were we to do some of these things. And yet it doesn't happen. And maybe that's a bigger discussion than we have time for, but I'd be interested if anyone has a view on that. I also wonder if the way that we frame stuff, because having a commission on health inequalities would be excellent. If you reframed it as a commission on how we all get on better and live together better, some better words than that, but that could get a more positive element to it, while also looking at investment in housing and so on and so forth. Gail, that point or any other point you wish to make?
It was just picking up on the previous speaker. Sorry, I'm dreadful with names and I've already forgot because you disappeared off my screen. When you were talking about a commissioner, but not in cabinet, because I totally got where you come from. I was wondering if a comparison would be like the children's commissioner, who is national and independent and almost holds the government to account. So like a health inequalities commissioner who holds the government to account and challenges back, and that's I don't know if that's capturing what you were describing or if you know about that, but I guess that's what came into my head when the previous speaker was talking about something that didn't just get dismissed next time somebody changed a policy.
Yeah, interesting one. It was Ben who was speaking earlier. I'm reminded, and maybe this is a bit insignificant, but about 5 years ago, there was a UN commissioner called Philip, somebody, who did a review of, and I've forgotten the details so much, but he of life in UK, and he did conclude about the levels of poverty were, excessive, and that we were not necessarily a rich country, but a country with rich people in it, but ostensibly a poor country. and it got buried under a political response. But nevertheless, it's still there. I think I came across it in one of my documents to read folders. Anyway, John, go ahead.
Thank you. Yeah, I agree. I think the idea when I was talking about the commissioner is exactly that point of, you know, something similar to a children's commissioner, but, you know, I mean, it could also be something else. We've got other examples that have, you know, worked quite well overall. So we had social inclusion units, for example. Social inclusion unit was embedded in the cabinet office, and that, you know, you could argue that that drove some issues as well, but actually it did drive a cross-government response to very specific educational disadvantage, and I think there was something really useful in that. So we do have tried and tested methods here for doing this, and I think to be talking about these really early in manifestos and in really pushing on political parties with this is quite a good time to do it, because they did also hold governments to account. They were really quite powerful actually in their time. So I'm just saying that we've got models here. We've got models both through the Children's Commissioner and other commissioners. You know, we've got a Victims Commissioner as well. We've got quite a few of them, but we've also got Social Inclusion Unit as in the past as well.
Indeed. And I think practical examples of what we need. Thanks, Gail, for putting up a link to the Children's Commissioner for England, and thanks to Grace for that link to a recent report focusing on the state of poverty in the UK. Jen, go ahead.
Yeah, I just wanted to kind of circle back to children and young people. I think maybe it's time to ask for that new child poverty target to be brought back again. I know that's what the Children's Commissioner is asking for. I think even locally in Barnsley, we were able to use that to actually measure where we were. So maybe that would be something that, you know, could tie in some of the discussions we've got here. And then the other thing, I think it'll probably happen eventually, but is the reviews decent home standard and get it right, but the health and housing rating standard system, because that's the other kind of lever that we've got around housing standards. So just making sure that happens and is updated so that we can kind of.
Excellent. Thanks very much, Jane. Okay, we're down to our last 5 minutes, and we have. Oh, I was going to keep that list up, Alison, if you don't mind, and invite any. I mean, what we will do is work. Alison's done a fantastic job in capturing what everybody's been saying here, and what we'll do after the webinar, but it'll be next week, I think, is do some editing on this to capture the rest of the points that people have been making, and then shifting around some of the way that it's presented as a kind of 1 to 10 list. Is there anything on here that people want to make a last case for moving up the agenda? John's already suggested we get social determinants higher up in the agenda there, which we'll look to do. Anything else that people want to pick up on? I was thinking that the public sector equality duty issue we would move higher up. Perhaps tie that into the point that John made about human rights as well, and an equality issue there, as a more as a kind of more beefed up point, I suppose. And we'll put the private rental sector part in under a broader housing point as well. John, I'm going to put you on the spot again, or you might be able to help with a link to the work on local power, community power. I think that's something I'd be interested to understand a bit more if there is a possible link for that work. And I think what was coming in at the end of that discussion as well was about that Health and Equalities Commission or Commissioner at government level, with the examples being around the Children's Commission as well. That will make sure that features higher up the list too. Okay. This is your last chance. Anything anyone else wants to add? If not, then thank you very much. Thanks, John. That's been really helpful and really interesting and fun as well. Actually, great to share these ideas with you and to find out where the priorities lie in your work. Also, great for me to hear from people, and you've just popped up there, who clearly are more closely involved in things like health and housing work, whereas I tend to engage with this stuff at a more strategic level, but you clearly are more engaged in some of the practice there, which is excellent to hear from everybody else on the call as well. Okay, I think that's it. Thanks very much for joining in today, and hopefully see you again in the new year. Have a good holiday in the meantime.
Thanks, everybody. Happy Christmas.
Thank you. Thanks, everyone.
Bye-bye.
Bye.
Thank you. See you.